Today I'm going to be showing you how to give your newborn a bath. The first thing you want to do is make sure that the temperature in the room is around 75 degrees. Babies have a really hard time keeping their temperature regulated, so we want to make sure that the outside is and make sure we keep the blankets over him. So the first thing that you want to do is make sure you have all the things that you're going to need for the bath already laid out. If you do realize that you've forgotten something, just make sure you have one hand on the baby at all time. If you have to reach around and grab anything, you never want to leave the baby without your hand on him, because babies can't roll yet, but they can still fall on the ground. So the next step you want to do is make sure you fill the turtle tub up to the line. You never want to fill it past the line, because then the baby's mouth can get water in it. Then you're going to fill the tub up and move the faucet out of the way. When you grab the baby out of the crib at home, make sure that you put the crib like side down, so it's easier for you to move the baby. Then we're going to go ahead and we're going to put the gloves on, because anytime that you touch the baby before the first bath, it still has the blood and the amniotic fluid, so you're going to want to make sure you put the gloves on before you give the first bath. You always want to make sure you wrap your baby in a towel and have another towel sitting here dry, so whenever you're finished you can go ahead and put him on that. So we're going to take the towel and the baby, put him in the water, making sure that the water's still at a good length, so it's not in the mouth or whatever. We're going to go ahead and take the washcloth that we have. We're going to dip it in the water. When you're washing a baby's face, you never want to use soap on the baby's face, so you're just using the water. You're going to take just like your hand, and you're going to wash the baby's eye from the inside of the eye to the outside of the eye, changing where you have your spot on your towel and doing the same thing to the other side. You want to do this in case one of the eyes has an infection in it. You don't want to spread the infection or anything like that. Then for the rest of the face, you're just going to stay with the same towel, same water. Go ahead and just wash the rest of the baby's face, wash in the ear, behind the ear. You never want to put anything smaller than your finger in the baby's ear, because the eardrum is close and you don't want to hurt the eardrum. So nothing like a Q-tip or anything to clean out the baby's ears. So then once we're done with that, we're going to open up the baby's chest area, making sure the legs are still closed, covered with the towel. We're going to go ahead and make sure we take some soap now, and we're going to rub it in our gloves. We're going to move our hand over the chest, under the armpit creases, making sure that you're getting inside the hands, because babies can spit up in the hands and then they clench their hands and they can't get it out. So then we're really making sure we're getting under the neck in case they spit up. Go ahead and get some of that water and just rinse the baby off like that. Then once you're finished with that, we're going to cover the baby. Go ahead and uncover the legs. So you're going to take some more soap, wash the baby's legs, both legs, and then just rinse them with the water. And then at this point, you can go ahead, you have your other towel here, go ahead and lift the baby up out of the water and go ahead and lay them on the dry towel. You're going to want to swaddle them and do the best you can to, dry them off. At this point, you're going to put them in what's called a football cradle and go back over to the water. You're going to hold the baby over, making sure you have holding the baby's head so you're not hurting the baby's neck. You're going to take the washcloth with the water and really soak that baby's head. And then you're going to get some soap, really get that soap on the head. You want to really make sure you're scrubbing the head because there's still going to be the amniotic fluid, some blood. You just want to make sure you get all of that. Once you scrub it and you think that you've gotten everything off, you're going to take the washcloth, really just get the soap off there for the baby. And then I'm going to use this as another dry towel because I didn't have enough one. So then you're going to take the baby out of this towel and lay him on a dry one. Making sure that you really get the head dried. Then we're gonna go ahead and talk about some peri-care and how to put on a diaper. For a baby who is a baby girl, you're gonna want to wipe from front to back. This is gonna help with not getting any fecal matter in their in the baby's urethra, causing UTIs. You never want to use anything that is any powders or anything like that because it can go into the respiratory tract. You're also never going to want to use any lotions or oils because that can clog the baby's pores. For a baby boy who is uncircumcised, you're never going to want to, you can wash the baby who is uncircumcised with soap and water, but never do you want to retract the foreskin because when you do retract the foreskin, it can get swollen, the penis can get swollen and then you don't want that to happen. With that, you can also see that if you don't have the baby circumcised, that the foreskin will get looser as the baby gets older. For a baby boy who is circumcised, you will go ahead and just wash it with water, and then rinse it off every time, and for all of these, you would want to do this every time you change the baby's diaper. For a baby who's circumcised, the first 24 hours, they can have like a whitish, yellowish film on it. It's totally normal. It's just tissue, so don't worry about that. You also want to make sure you take a piece of gauze and you want to make sure you take a piece of gauze, put the gel on it, and put that on top of the penis so that it doesn't stick to any diapers. So for the diaper, you're gonna want to see about 6 to 8 wet diapers a day. That will show that the baby's getting enough nutrients. So for when you're putting on a diaper, you're gonna lift the baby's legs up. You're gonna put the back underneath the baby's butt. You're gonna take the top, bring it up. You're gonna fold it because the umbilical cord's still there. We don't want the umbilical cord to be covered. We don't want it to get wet or anything like that because it's gonna end up drying, and then after like 7 to 10 days, that'll go ahead and just like fall off on its own. One thing that I didn't mention with a baby girl is that the first 2 weeks, you'll see some white discharge in the labia. Don't worry, that's nothing to be like worried about. You go ahead and just as you keep bathing, it'll go ahead and go away. So another thing with the diaper is when you move the stickies over top, make sure they're tight and that you don't have any like loose room. You don't want it to fall off. So at this point, when you have the diaper on and you just given the baby a bath, you'll go ahead and use what we use one of the swaddles that we have at the hospital. So you'll put your arms in it, put the baby's arm in it, put the cross the arms, and then it kind of like velcros like this. And this is to help prevent SIDS, so that you don't have to have anything in the baby's crib with them, any extra blankets or anything. This will really keep them warm. Talking about SIDS, we don't want to have Like I said, anything in the crib. You don't want toys. You don't want blankets. You don't want any of that. You want to make sure they're laying on a firm mattress on their back. If you do want to have some tummy time, make sure that you and baby are both awake, and that that's only for like building strength in their arms and in their like neck. So you don't want to do you don't want them to be laying. They can have a pacifier in their mouth if they want during nap time. Other than that, just make sure you're not having anything around baby's mouth to have them suffocate. So the last thing that I'm going to show you is some hold. So once you have your baby swaddled, this is called a cradle hold. It's so that you can have one hand free. You could feed the baby if you're doing formula. If you're breastfeeding, this is a great way to breastfeed. You can have contact with skin, eye contact. This really helps. You have the upright, which is up like this. This is good for burping, eye contact. This is also just if you want to bounce your baby a little bit to get him go to sleep. Then you also have the football hold, which is like this. This is the one that I demonstrated when I was giving the baby the shampoo, when I was shampooing the head. This is also good for breastfeeding, good for eye contact. And yeah, I think that's it. Thank you.